Hello guys, welcome to our channel. Today we have the aspirant, the Dr. Muskan Gaba, who has secured the 210 in the recent FMG examination. So huge congratulations, Dr. Muskan, for your success, and it's incredibly really great because this is one of the toughest FMG examinations in the FMG history. But you have got really good score, and congratulations on that. And the great news is that she is also the alumni of my DMSF. So she is also part of the alumni. So this is a very proud moment for me as well. So hi Muskan, please just introduce a bit about yourselves.
Hi, I am a pass out from DMSF. I am actually his junior. I used to talk to sir when I was in fourth year. That's when I connected to him because I think that was the initial point where you started mentoring. Also because I think I am, I am. You are IMD 22. I am IMD 25, right? So I just started my preparation when, like in the starting, I just used to solve questions. I used to see Marrow main videos during my fourth year. I was not very consistent with that. But after my graduation, I started studying seriously. And when I asked sir how to study, he just told me solve a lot of previous year questions and focus on the topics and try to understand the concept, but never let go of the questions. You try to solve as many as you can. So I just took that advice seriously.
So how was your preparation started? When was the preparation was started?
Seriously, it started on March 25 after my graduation. I traveled a bit with my parents. They came for my graduation after that. But before, I used to study during my fourth year, not very much per se. I just used to, I watched some main videos from Marrow and then some subjects I completed. I used to solve questions on Telegram groups and even, like I was not very, but I used to look through things because I didn't want to lose touch with knowledge. Because in fourth year, during our clinical years, we get we lose a connect with the studies. I didn't want to lose that connect. That knowledge gap happens when you stop studying. Then you forget everything. Then you have to start again. So I just kept on studying. I didn't memorize anything. So I just know like what's going on. Like
Yes,
maybe
yes,
one
actually.
hour, 2 hours a day, like that. Not very much.
And also from the DMSF rotations in the SPMC or
Yeah,
any
that
rotation, it's
that
hard to
is
manage the.
Yeah, that is true. But I used to do it during my school, like school rotation. That was not very hectic.
Yeah. So you used to spend at least 2 to 3 hours in a day.
Yeah, like minimum 2 hours on average. Sometimes I used to study more during some rotations like psychiatry, where we had to do biometrics. So I used to sit down in the library. Even community medicine, during community medicine, I studied. So whenever I could find time, I used to study. Sometimes in the hospital in night duty, I didn't find time. So I used to watch one or two videos. Yeah, that like at least if you take an average, at least 2 hours.
Yeah. So what was your main resource, Muskan?
Main resource, like for my serious preparation, I did from King's Arise.
King's
Uh,
Rise.
yeah, I did from King's Arise, and yeah, they had that option, so I went there in King's Arise, Chennai. So I studied there. That was my main source. But during my fourth year, I referred to Marrow. And in Telegram, I used to do one take FMG that questions. So yeah, these were like three resources. And then I used to watch your videos also during some lectures. I watched that. Even on my last day, I watched your short series. So I used to watch like some series every here and there. So like that.
How did you manage actually this many? Because sometimes we get confused between different platforms and different things.
Yeah. So for King's Arise, their lecture notes I refer to, like to memorize. For the memorization part, I refer to the King's Arise, like the notes, what teacher said in the class, and I used to memorize it again and again. Their QRP session, even to the last, whatever part I had to memorize, I focused on their notes. Then, but for the Q Bank, in my last days of preparation, I referred to Marrow, like the previous year questions I didn't solve from King's. I From the Rise app, I solved from the Marrow app the PYQs because I thought the explanation was better there. And then for sometimes when I had to revise a subject quickly, like in an hour, for like for example biochemistry or some subjects that were too volatile, I referred to your notes. And then Telegram was like core concern when I was bored. When I didn't want to do anything, but I still wanted to study, like when I'm talking to my friends or we are just doing time pass, so I'm just solving questions like that on Telegram on one take. So I used to solve like 200 questions even while waking up. You don't want to do anything. You're taking breakfast, so you solve questions.
How was the difficulty of the examination? because you have given the Telegram questions, different Q banks also. Comparing to this
Yeah.
Q banks and the recent question paper, how did you feel the difficulty?
I felt it was a mix of things because there was not one examiner that came. Like because I noticed in the paper that forensic medicine like questions had a different, like English is different for all questions. Some questions like surgery questions they were tough. Forensic medicine were tough. Like the language was tough, but the question was easy. So they framed it in such a way that students would think the question is tough because they framed it in such an elite English, but they were really easy. So like that they just the language thing, and then like most difficult I thought was surgery because they asked staging and management of cancers, and then you had to really think. And patho was easy for me, so it was like mix from the workbooks like we usually say or PYQs. I'd say the paper came only 30%. 30% paper came. Rest of the paper you only had to do. Like so many things I just saw from DMSF. I learned from DMSF, so I could apply.
Yeah. So the difficulty level was is mixed because we
Yeah.
can see the concepts are
Yes.
same, but only the language twisting,
Yes.
concept-based questions.
Yeah, and they tried to confuse. For example, they tried to make sure that students who study well mark PYQs wrong. Like, for example, they manipulated the questions. For example, there's a very famous question of perforation, like intestinal perforation or ulcer perforation, and then patient has peritonitis. They described everything. And usually, what we do is patient has low vital signs. So, what you do is you mark the answer as uh, omental patching, right? The grams
Yeah.
omental patching. But then they told that the patient is stabilized by vital signs. Now what will you do? So I thought it is something else, and I marked that answer wrong. That is like one of the questions that I got confused because of their language, because they
Yeah,
changed the
because
last
they
line and
wanted to
it is
trap the
distracting.
students.
Yeah, because if you're not aware, because what we do is we studied it during emergency times. So, like, that is how all the teachers taught. They didn't teach it like, what if the patient is stable now? I didn't think like that. And then you have 1 minute, which is the hardest part. You have to analyze everything. That is like, that you can only get that skill if you solve enough questions.
And what was the video-based questions? How did you manage? Because 1 minute per question, but the videos are 30 seconds, 40 seconds long.
So video based questions were easy. For example, chopstick sign. If you see that image and if you see that video, it's the same. It didn't take like it didn't take much time. You can just click on that video, you can see the sign is shown. And there was one more video of a cerebral palsy patient. I could identify that patient, spastic cerebral palsy, because I saw that patient in real life in my SPMC rotation, my hospital rotation. Because I never studied that anywhere. I could just identify the patient. They just saw like they just showed many patients. For example, there was a patient of TB knee. So I could identify that patient because I saw images. So like how I studied differently is I had a gut feeling that our paper will be consisted of many image based questions because a
Yeah.
lot of people were explaining images, like especially like Telegram groups were saying like image based will come. They focus on that. So I thought like whatever I study, and also I'm a visual learner. So whatever I used to study, I used to like search images on Google. Yeah, so some like it was like video based questions were fairly easier than the theory questions, I would say. You just had to identify them. They were very simple.
How did the DMSF played the role in your preparation?
DMSF actually like the clinical rotations that we had, and the doctors sometimes will teach us something in the class, in the school, or you'll have exposure to the hospital duties. So you can apply because there were so many clinical questions in the paper. I think in the second half, 40 questions came like purely clinical. So I had no idea. They were not from the workbook. They were not from previous year questions or previous year topic. I could only solve them because I thought, yeah, this is how my doctor must manage, or what I saw or observed in the hospital, or I had a gut feeling how I will manage as a doctor. I just marked all those answers. Like simple, like conservative management. For example, there is a neck trauma case. In that PYQs, it is wrong that zone 1, 2, 3. So they mentioned that the patient had stable vital signs. So why would you go do surgery? So they mentioned first do imaging and then you do surgery if you find anything. That was the answer, I'm pretty sure. So students just memorized PYQs and they didn't apply it. I think that's where the knowledge gap happened. You actually had to read the question properly and you had to apply it.
Yeah, concepts is must actually.
Yeah, because it was not directly line to line. Because our teachers taught us zone 1, 2, 3, but They also taught us you have to analyze the questions, but students sometimes forget that they only remember that zone one, do surgery, and that was there in the option, but you didn't have to mark that because you had to analyze that the patient was stable.
How you practice this solving of the questions, because the time is less, because you said you started preparation around the March, so it was
Yeah,
just 2 to 3 months. And how about the
yeah.
Q bank per day? How many questions and how many GTs that you get?
GTs I didn't give many, sir. I just gave five GTs. I gave that national marrow GT. I got like how many did I get? I get 225 in that. Paper was like up to that level or easier. Part one I felt was easy. Compared to other students, I have a different opinion. Like most students said to you that part one was tough and part two was easy. But
Yeah.
I think they thought part two was easy because they thought it was directly from the PYQs. It was not. That's why I thought it is tough. Part one was easy. Like directly came from the workbook or something similar came. Or some science, basic sciences came like 11, 12 or PSM numericals
Hmm.
like that. But part two was tougher because they were clinical question and you had to analyze each and every option and then you had to think and mark.
Okay, how about Q bank? Which Q bank you prefer?
I did Marrow Q Bank custom modules and then the FMG PYQs. I did NEET PG some questions. I couldn't complete NEET PG NICT fully, but last 2 3 years I did. And one take I did. I was a subscriber of that, so I used to solve their questions. At least they helped me be there for like imaging questions. For example, a question came. I can just give many examples. I'm sorry of Wilms tumor and neuroblastoma. So in that question, everybody marked Wilms, but I think the answer was neuroblastoma. But because the history given was the patient had pain. In Wilms, I think the patient is usually
Painless.
painless. So that was given in the question. You can't rely on the imaging. You have to correlate it with that. So they told that the patient is having pain, some like painful hematuria or something like that was given. I'm pretty sure about that. That's why I marked the answer neuroblastoma.
Okay. So how's your happiness with the results?
I'm very happy with the results, sir. I've been using social media since yesterday. I didn't use it for 4 months, even after my exam. I was just waiting
Yeah,
for the result.
great,
Yeah.
great.
And
And
yeah, from my mock test, we used to score 225 and I got 210 in the real exam. So for many students, like for most of my friends, whatever they used to score in the mock test, even Marrow or other GTs in Arise, I used to get the same marks in all GTs, be it from anywhere. Like I used to have that 60 70% accuracy, but it used to be higher in exam because you are so stressed, because it is so
yes,
hot. You know that, right, sir? And then your mind is tired, you don't have a water bottle, and then you have to go, like the paper is actually 3 hours, but you have to go like 1 hour prior, and then you get tired at the end because of the examination anxiety, so you lose like 10 15 marks. I also made those silly mistakes. I know where I did. So everybody should know that the mock test scores, you'll score like 10 or 15 marks lower than that because you will lose those marks because you are anxious.
yes. Actually, for me as well, because my last mock test before the examinations, it was same. Because due to the stress, we make some silly mistakes in the examination. Also,
Yes.
some suddenly, and also you guys have the many surprises in the examination and this
Yeah.
tougher level also. But you have done really great job. How was your parents' reaction?
My parents are really happy. They took me out for dinner yesterday. So they are all really happy. And my dad was predicting my marks. So he said that you'll score this much. He said you are 200 plus. So he's very happy. And my mom is also
That's
very
great.
happy. Even my brother, he scored 198. He's also very happy. He's also very proud of me.
Yes, yes, and I am also very proud that that you have great scored, because I have been in touch with you in from your last fourth year, and also from the
Yeah.
Marrow classes also, and recent FMG preparation also. You have done really great job, and many DMSF alumni students also. I just wanted to tell them that take the inspiration from the Dr. Muskan, because she has done managed the clinical rotations also. She has been in some post also, in the academic post also,
Yeah,
administration post.
I managed my
Yeah,
batch. Yeah,
yeah,
that was
so
hard
despite
task.
of all these hardships and managing everything, she had secured the great score. And you also learn the preparation from the Dr. Muskan and the guidance you can take care. And that's great actually, managing everything and scoring the grade, because this will give us some competitive spirit that the FMGs could make something really great also, by despite facing many challenges, whether you can say economy and also different types of situations also we face, right? So, so really great, Muskan, that you have scored really great. And I just wanted to ask the last question that how did our videos that have helped you
Videos.
of our
So
short series and the rapid
oh,
revision videos?
that was really helpful because it used to give me some confidence. There was, I didn't memorize all subjects, but it was like a good revision because unlike other faculty, because faculties even in prep ladder they'll post 1 hour video and of one subject. You can't do that.
Yeah,
So when I used to saw your videos, when I used to see your videos, they were like 1 hour video of everything, which is a good enough source. Even if I don't have time, I can watch that in 2x. I can do that 30 minutes. So I could just revise some things here and there. And it was like, because that is a very difficult task to compile all these things into one. And you did that. So it just boosted up my confidence. Like I am revising so many things at once.
great, great. And we are also very grateful to be part of your journey. And what was the suggestion that you wanted to give those who couldn't clear with your and in the examination and also upcoming students?
For the students who couldn't clear, my advice is see, the exam did not have a negative marking. And I feel like there's no knowledge gap between a student who scored 190 and like for me, I scored 210. I don't think there's much knowledge gap there. So, and similar for the students who scored like 145, 147, and 150. It's a very strict cutoff, I feel. Like you should not take it to the heart. Maybe that day your luck was not there on your side, so if I was there, I'd just make sure that my hard work is so much that luck is never a factor. That day, I know that student who scored 150 and student who scored 147, they worked equally or they had the same level of knowledge. But you should not rely on that. You should work more hard that the next time the battle is there, you are scoring so much that the gap is so much that you are scoring 180, 190 at least. So there is no border, there's no luck that can affect your results.
Yes. Actually, despite of the challenges also, the many students have giving up the many attempts also like second attempt, third attempts. But the day by day, the tougher level also is increasing with the examination. But we should not take it to the heart. And whatever is going to come into the battle, we have to face that and we have to prove. Because
Yeah.
nonetheless, the talent and the hard work and concepts will pay off one day or the other. Because the facts, concepts are same. Wow, how
Yes.
tougher level he increased at least
Yes.
50% the concepts are same, the PYTs are
Yeah.
same. So, and also we should stand with all the students with the solidarity because of their hard work and also
Yes.
NBME behavior because without prior notice, the video questions that made some students at least anxiety. Because of the anxiety,
Yeah.
we may lose some score. So
Yes.
we should
That's
also
true.
stand with them. And yes, Dr. Muskan, and we also going to like stand with you because the NBME behavior also, whatever the hardships that we have faced, but we will prove this. This is not going to pay off our worth. We'll deserve better and we will score better in the upcoming examination. And once again, congratulations, Dr. Muskan, and huge congratulations and many wishes for your future endeavors. And I am also wanted to take your next Need PG interview also. Congratulations in
Sure.
advance and all the best for your
Sure.
future.
Sure. Thank you, sir.
Okay.
Thank you.